Well, hello everyone. Thank you for joining us for the first webinar of the 2026. We always do this webinar on the first Saturday of every month, but because we were so close to the new year, we moved it to today. And I wanna wish everyone a healthy and successful year for 2026. And again, appreciate taking time for you guys to join us to talk about weight loss surgery and talk about Mexico Bariatric Center as a top provider for weight loss surgery. I I am expecting Dr. Montalvo to join me from our hospital, Azar in Tijuana. I am actually in our office in Folsom, Sacramento, as I'm reaching out to you. Just to go over what we offer today, um, we've been doing raffle for $2,000 off of the package, surgery package. And basically, all you have to do is have submitted a health questionnaire in our system. Dr. Montalvo is the one that would be um, the raffle would be for surgery raffle would be for, and I would release the Zoom poll during the end of the presentation, and all you have to do is watch and do the Zoom poll, and you'll be entered automatically into our drawing. Again, by doing, if you have not submitted a health questionnaire before, just go ahead and go to mexicobariatriccenter.com and submit a health questionnaire. And basically, if you have submitted one before, you don't have to do it again. We try to cover as many questions that is frequently asked. And during our presentation, if you didn't hear the answer to your questions, please feel free to add it in Q&A tab, and we will get to it at the end of the webinar. We try to um, keep this under 2 hours, and if it went over and we couldn't get to all the questions, it's very simple. Just circle back with us. You can call us, contact your coordinator, or even, email us, and we would be more than happy to answer your question. Just a few words about myself. My name is Elli. I am the founder and CEO of Mexico Bariatric Center and Hospital Ozar in Tijuana. I got involved in the medical tourism, specifically in Mexico, in around 2007. I've been traveling to all locations in Mexico and very familiar with the healthcare down there. I started MBC under brand Mexico Bariatric Center in 2012. And we've been top provider for bariatric and cosmetic surgery in Mexico, specifically Tijuana, because Tijuana has a lot of potential. Proximity to US, it's becoming a compound for bariatrics and cosmetics and other procedures as well. And since inception of Hospital Azar in 2024, we've been able to offer more services to our patients that goes hand in hand with bariatrics. For example, cosmetics and plastics is been a huge addition. And to our services. We started offering Botox, fillers, skincare end of last year. We constantly offering newer procedures, including bariatrics, that we will go over, Dr. Montalvo would go over. Um, we've been offering gynecology like endometriosis, hysterectomy, um, arthroscopic surgeries for knee and hip replacement. And newly, we've been offering stem cell for a variety of reasons. One is for anti-aging and, for example, knee, spine, shoulder surgeries, soldier injuries, I'm sorry. We've constantly published new content. We're on the leading edge of um, procedures that we offer. So I recommend you check our website constantly, especially our blog posts. Actually, Natalie just did a um, blog post and a video about high protein recipes for like gummies and um, we've been doing meet and greet by myself. I just came from Australia. I had meet and greet several places in Australia. Of course, we just finished our New Zealand seminar in 3 locations, and I went to Australia. Right now, actually, um, Vanessa is in Australia doing meet and greet. Um, Jamie has been doing meet and greet in Seattle, Washington. So, and then we've been offering more group travel. If you're interested, you reach back to us and we will let you know more about it. Like I said, the new procedures that we offer, like bipartition, intestinal bipartition. So there is a lot that we've been. So it's a great is a great um, resource for you to constantly check to see what's new and what are we doing. Um, just some updates. I am so pleased to see the sign finally of Hospital Azar outside of the building. We've been working on it a few years. Finally, we got that going. And there are some milestones. We celebrated 1 year last year of anniversary of Hospital Azar. Um, and we have reached over 1,000 Google reviews, which is the highest any competitor has in our industry. I mentioned the travel packages we've been offering, and these are really something that a lot of patients are interested in. Um, just a highlight of our seminar. That was my first time in New Zealand. It's a great country. Dr. Gutierrez and I went to 3 locations and we had a really good turnout. So, just the outline of what we are going to cover today. Basically, we talk about transparency, education. We've been educating about the surgery, about MBC since the beginning. 2015 is when I first went to Houston. We've been in US, Canada, um, now in New Zealand, all over the world, explaining what bariatric surgery does and what you should expect as an outcome, the complication rate, all that. We've been educating people, and of course about MBC, which is the top provider of medical tourism in Tijuana. We would talk about, of course, just the definition of obesity, the risks, how to see, how to calculate your goal or your ideal weight, um, and how the weight loss surgery is a metabolic reset, and what's the difference between weight loss surgery and other options, which is um, right now, of course, diet and exercise always, and Ozempic type of GLP-1 medications. We will talk about Hospital Azar and why Hospital Azar has been a game changer for our patients, for us to be able to provide even higher quality services to our patients, and how we support patients, what programs we have to support patients pre-op and post-op. And Dr. Montalvo would be talking about all the different procedures that we offer. We would touch on the financing, the payment options we take. We would talk about medical tourism insurance, huge. Again, that's another game changer for our patients. And our nutritional program. And we do the Q&A session. Like I said, that we cover as many questions as we can answer, and we would do the raffle at the end. We all know what obesity is a multifactorial metabolic disease that is growing worldwide, including US, Canada. And basically, um, we would see how it's defined. Basically, in the medical field, you have a formula that you plug in your height and weight, and it gives you a number. That number, of course, it's it is generic. I would show you the chart of how actually needs to be calculated in a fewer more slide. But the idea is that if the BMI is less than 30, we are in a normal and what we call overweight zone. Our center takes BMI of 30, and there is no limit of what the higher the top number it is. We have done over 100 BMI in our center, so there is no limit of what we can do. But there are some instances based on the procedure or the surgeon or the metabolic condition you have. We can do a BMI of lower than 30, maybe 29, 28, and we would explain that. Now, to be precise of what our ideal body weight should be, this is a chart that can help. Based on our sex, whether we are female or male, and our frame size and our height, you can tell what should be your ideal weight. If I'm a female 5'4" with a medium frame size, as you see in the chart, we have highlighted it with red. Um, the ideal weight should be around 120. And if I weigh 220, that means I have 100 pounds extra weight to lose. And this is how is defined. Like they always say, the percentage of extra weight that you lose. So when we talk about, let's say, 80% of extra weight average is lost, that means 100 pounds, 80 of it is 80 pounds is lost. But there is no, these are just average numbers. Every situation, every person has a different story and different parameters, your lifestyle, your age. As you see, age and ideal weight is also not something that is constant. Very quick. When we gain weight, our fat cells not only increase in numbers, they would change. Um, they would change in structure. Um, So um, they just let me know um, that Dr. Montalvo is finishing up his procedure and he will join us shortly. So I keep continuing. Anyway, so when we're talking about the fat cells structural change, the composition change, basically causes all the comorbidities that we experience. One of them is the structural change of the fat cells or adipose tissues to make us be insensitive to insulin, insensitive to leptin. Leptin is basically, there are two hormones, is ghrelin and leptin. Ghrelin is a go eat hormone, and leptin is a stop eating hormone. So you can think about it like that. So you become insensitive to the stop hormone that tells you stop eating. And so then there are other um, side effects, which is we don't respond to therapies. We don't respond the same way to vaccination. We don't respond to protein and exercise, which happens when we age, but this happens prematurely when we gain weight. We talked about um, the what contributes to this epidemic. Increased nutrient content of food we eat, fast food, lack of physical activity. We're sitting on our desk made the majority of the day. We go home, we stressed, we start eating, comfort eating, stress eating. The sugary drinks, the sugar and other ultra processed in the food, not getting enough sleep, we constantly on the run, and we use too large meals. 40% of adults in US are impacted. Little less impacted in Canada and about the same in New Zealand, and they have all these side effects, comorbidities. And during COVID, we realized that we need to lose weight or end up in the hospital with COVID, in ICU, or die from it because there are more fat cells, more places for coronavirus to attach itself. So, what is the cure for obesity? Diet and exercise is the first thing that comes to mind. Um, of course, since the beginning of human history, we've been always looking for a pill, magic pill to take to lose weight. And now is Ozempic and GLP-1 injections, and soon to have tablets coming that is trying to do the same thing. But to this date, bariatrics is a gold standard and proven quick, safe, and long-term sustainable weight loss solution. And now actually they call bariatric surgery more like a metabolic surgery because we always talk about, oh, losing weight. How about all the metabolic resolution that it does for us? And so basically, we want to call the bariatric surgery an ultimate reset. Like I mentioned, is a gold standard. Um, so why not get this life-changing surgery and get the elite version of yourself? There are so many benefits of getting this surgery, and sometimes they call it a shortcut. It's not a shortcut. is a strategic tool that you acquire that would help you lose weight, reset your metabolic system, add years to your life. There's so many benefits of it, self-esteem. And if you guys have any doubt, like, do I really want to undergo this surgery? Talk to our affiliates, talk to our coordinators. More than half of our coordinators, you see the team that we have are past patients that have the passion to come work with us, support you guys. Don't be shy. Take the phone, pick up the phone, and call us. Talk to one of this team is like a dream team. I will show you later on their names, and you're welcome to contact any of them. Like I said, diet and exercise is great. We always need to eat clean, try to eat clean, and be active. Whether we exercise through in the gym or we walk every day, half an hour, this is something we need to do regardless. But the surgery helps us achieve this faster and better. We were talking about metabolic reset, right? This is how the metabolic reset works. If I weigh 250 pounds, my brain and my hormones are interacting and is used to interact around this set point. If I go on an extreme diet and a boot camp type of exercise and manage to lose 75 pounds, my brain and my hormones are still used to that 250 pounds. So what it does is it wants to take me back to that by increasing my hunger and lowering my metabolism. Now, bariatric surgery resets the metabolic system, which means the minute you wake up from the surgery, your brain and your hormones are interacting at a lower set point, which is, let's say, 175 pounds. So as a result, you won't get as hungry as before, and your metabolism goes up, which means it burns fat. That's why you lose weight fast and you keep it off. Okay, so we talked about the GLP-1 medications. It's a great medication. You'll see in a moment where they actually stand as far as the pyramid of weight loss. So what they did was they looked at what are the hormones that are changed as a result of bariatric and metabolic procedures, and they tried to make a synthetic hormone to simulate the results of bariatric surgery. Remember, in bariatric surgery, you're actually getting a restriction, which means you would have limited space to eat at each meal, plus all the hormonal changes that are naturally occurring as a result of the surgery. And as you see, there is so many of them. This is just a list of the very prominent ones that researchers have found out so far. And even like Manjaro, which is the best weight loss injection, only has two of these. And the deal is you have to keep taking them so you can keep the weight down. Whereas weight loss surgery is something that these hormones come to you as a result of surgery and resets your metabolic system. So, what is the deal with GLP-1? First of all, the inconvenience, the high prices, the accessibility. You have to keep taking them. Um, there are some data that just showed that 70%, especially the older people, 70% stop after 1 year due to stomach issues, all the other problems. And ultimately, bariatrics is giving you 5 times more results than the injections. There are some vision loss problems. There are some side effects on your kidney, gallbladder. Anyways, so it comes with its own side effects. And here's the pyramid of weight loss treatments effectiveness I I promise to show. So diet and exercise only works for small portion of the population, and of course depends on what BMI you're at, right? If your BMI is close to 35 or 30, it's so much easier to lose weight than if your BMI is 40, 45, 50, 55. Those are like very hard uh, to deal with. And as you see, the GLP-1 medication is, again, it works for a smaller portion of population. And then it comes endoscopic procedures that would still work, but you need a lifestyle change. You need to have discipline. And again, your BMI needs to be lower on the lower range of the spectrum. So gastric balloon, ESG, which Dr. Montalvo is going to touch base on. And then we would have bariatric surgery, which is, like I said, is the ultimate reset, is the gold standard, and which is like sleeve, bypass, do the nose switch. Where do we come to the picture is medical tourism. When in the past, when people talked about medical tourism, it was like, you think some back alley, uh, low quality. I see Dr. Montalvo joining us. Dr. Montalvo, hello. How are you? Great to have you. Thank you. Yeah, so when we talked about medical tourism, it was a misconception of um where you get some low quality hospital or you get like a inferior surgeon. We have taken this to the next level. As you see, this is a background of Dr. Montalvo. This is where our hospital is. I would doubt that the experience that patients have in hospitals there, you even can get it in US or anywhere in the world. Is top-notch hospital with the state-of-the-art facilities, and the doctors are amazing. These doctors are hard to find anywhere in the world. They're specialists in their field. They're young. They have so much surgeries behind them. And here's the deal. They are practicing their skills and their expertise every day. They're dedicated to this field. They're not going to do one general surgery, another surgery, and do one bariatric in a week or in a day. That's their, when you practice, you sharpen your skills on a day-to-day basis. And now I'm going to go off tangent here, but basically we'll talk about that. So basically we have taken this game to the next level by offering all that we offer, which means we would give you peace of mind. We do all the transitions that you have to make down there. Our staff are all with you. We have a coordinator that is speaking English there just to support you through the process. Of course, the hospital and hotel staff are there. Oscar is a great, for example, a asset we have down there that it helps every patient to go through this procedure in a safe and peaceful manner. Um, and Tijuana has established itself as the top provider for bariatric surgery. So where the global healthcare is going is like, okay, the zip code, the insurance, all that it's going to go away. Basically, you're going to find what is the best place and what's the best procedure for you, first of all. Where is the best place to go? And it could be in Houston, Florida, it could be in Tijuana, it could be anywhere in Europe. So the boundaries are going away because of internet, because of the way we travel, right? Right now, for example, you can get a flight from Auckland, New Zealand to LAX in less than like 12 hours, 11 hours, direct flight. These are the game changers that making medical tourism more relevant, and you save money, you get the best service with the best expertise that would you know, that fits your situation. Now, Mexico Bariatric Center, for example, um, we've been, like I mentioned, I started Mexico Bariatric Center in 2012. We are a US-based corporation, and this is something you need to look at. Bunch of these companies that advertise like us, they don't have a leg in US, or actually they're not uh, run like the way we run, and you'll see the inner working of our company in a minute. We have set the standards, the protocols, safety protocols in this industry for bariatric surgery in Mexico. MBC is a leader and is regulating the industry by setting the standards. Um, Actually, we'll be soon 14 years in the industry. With soon again, we passed 30,000 successful surgeries. And these are not just numbers that we're throwing out to say, to show off or lie about. These are numbers of actual patients. Again, our reviews, for example, our reviews are unfiltered. And when we have over 1,000 reviews, these are people who felt like we did good. And with the top 5 bariatric surgeon teams we have, so many reasons to choose us. But the main, again, we've been in the forefront of the industry. We've been transparent. We've been educating patients based on the data we have. When we tell you this is what you should expect as an outcome, we're not just giving you some numbers of the literature. We know how our patients are doing. We have a huge sample that we do look at and see how they're doing over time in 1 year, 2 year, 5 year, and we give you that data. When we say our complication rates, for example, is less than 1%, this is a data that we come up every year with our surgeon liaison, with our hospital staff, with our surgical teams. We come up with these numbers and we educate you what to expect. We never say our complication rate is 0. We're transparent. Our packages are laid out. We don't just charge you, get you down there and charge you extra for no reason. So we don't give you some surgery you don't need just to charge you. Actually, I would hopefully have one of our past patients, which is our affiliate, Kelly. Hopefully she'll be online with me, so she will give her testimonial. Again, why are we so successful? We were talking about safety protocols. We manage our daily surgeons' daily load based on the complexity of the procedures they provide, and we manage that. We don't give them too much surgery one day and less surgery the other day. It's even every day because of the expertise in the hospital. Remember, hospital is a hospital for bariatric and cosmetic surgery only. We didn't build this to take walk-in emergency and heart surgery and other surgeries. The reason we have so little complications is because of the hospital and because of surgical teams, expertise, and their load management. We don't pick some inexperienced surgeon to be on our team. I always compare the experience of the surgeon to the number of hours the pilots have been flying. So there is a difference between a pilot with 100 hours of flight time and a 10-year veteran pilot with 10,000 hours of flight time. Most of the time, nothing bad happens, but when you need that expertise and experience, your life is on the line. You know, that is actually one of the why we're so successful. We always talk about, okay, our team of surgeons are great, our hospital is great. But I think the type of patients that they come to us is great too. They are internet savvy, they do research. I would say easily more than 50% of our patients are referral, which means they've seen their friend, their coworker, their husband, wife, their friends, their family member go through this and they see firsthand what it's like to be a patient. And of course, the support we give them pre-op and post-op, but they are good at research. They go read about things and they're educated. We educate you. You're willing to get to learn, and that's why we end up with success rate that we have, right? So is not just one fold. It's so many ways. So I always, say that social media is great, but also it could be deceiving. If you are just looking at a video that was photoshopped or staged, that doesn't tell you the whole story. Um, Most of the companies that you see around, you don't know who the owners are or what's the infrastructure. They just hire some social media and they're putting out all these videos and content. But what is behind it? That's a question we need to ask. So I mentioned about Hospital Azar, and we're going to talk about it right now. Actually, the name came as a tribute to my mother, and basically, this is a private hospital exclusive to us, to our surgeon, to our patients, and is basically built around patients, not patients, medical tourists to go there and get surgery and come back. Our surgical suites, our recovery rooms, the hospital rooms, most of the rooms are private, almost almost all of them. You do get some double, which people who are coming as, buddies, they can stay. But in general, you get the best of the best. The views, the staff are so great. And these pictures are not photoshopped. It's real pictures. And we are accredited hospital. Um, all the equipment is, including the ORs, the sterilization, everything is top of the line. Like I said, some people come as buddies, and we can put you in the same room. Our process is very simple. Basically, we are actually a pioneer in this telehealth, which became more popular and more, you know, like in US, now they're talking about telehealth. We were doing this a long time ago. You submit your health questionnaire, we process it, we give you the go ahead, you are approved. You can actually book yourself online by paying a deposit, pick a date, and that's it. The rest is easy. We just finish your paperwork, our administration, our coordinators work with you to finish your paperwork. You tell us how you're going to get to San Diego, whether you're going to fly or drive, and that's it. And you are on the way go. Our packages have never been this affordable. We trying to keep, even we were supposed to have some price increases. We tried to keep it the same this year, 26. As you see, every price is going up. These are amazing prices that we can offer for all-inclusive packages. Again, transparency. This is what you get with the package. Our support group in Facebook is huge. We have several support groups. You need it before and you need it after. You need to be in contact with people that are going through the same experience as you do, and they will be a role model for you. You encourage each other. We have so many ways that you can reach us. Of course, you get a dedicated coordinator. We do have these webinars every Saturday of the month, first, usually. If it's a Super Bowl, we change it. If it's like this time, it was close to the new year. Our coordinators go live, nutritionists go live. Like I mentioned, Sarita is our past patient. She just told me she passed 8 years ago. She did surgery and she's been with us almost 5 to 6 years supporting patients. These are people you can reach out and ask. Okay, so this is our um, golden team. Sarita, Rena, Kelly. I hope Kelly is here. I'm gonna reach out to her. Tiffany is doing plastics. Laura, Vanessa is our New Zealand patient coordinator. She's in Australia doing greet and meet and greet. Anna in Canada, and Destiny. Destiny is a past patient, bariatric plastics, and she's new to us doing plastics now. We're very excited to have her. Jamie also, she's the one doing meet and greet in Washington. Almost every state, um, like Rena and Sarita from Georgia, Atlanta. So these guys are there to help you every day. Um, there's some podcast they do. I encourage you to get on it. We were talking about our exclusive network of bariatric surgeons. Look at the team. These are, again, dream team. Dr. Montalvo, which we have today, um, Gutierrez, Dr. Rodriguez, Dr. Jackie Usuno. She's been with me since 2008, 2009. I've known her. 2010. These are pioneer of this business and these surgeries. Dr. Jesus Ceja. And we were talking about how we support patients. We have developed complex routines that when the patient comes, remember, if we have done 30,000 surgeries, successful surgeries, that means we have processed God knows how many health questionnaires. Now, based on that, and remember, I do have, it's funny because I didn't talk much about myself. I have a engineering background. So I used my engineering and data-driven mindset to create this company who is not just a healthcare provider. We use the data day to day to improve and match the best surgeon for the best outcome of the patients. So the minute you submit your health questionnaire, we analyze that based on our statistics, and we would know where to send your health questionnaire for best outcome. Remember, these 5 team of surgeons, they are overlapping in their expertise, right? Each one bring an expertise that maybe some other ones don't have. So if you put all the expertise of 5 surgical teams, you see that's why Dr. Montalvo is going to touch base on the procedures we offer. That's why we are able to offer all that we offer because of these teams. And then we have a surgeon liaison on top of that, that she's monitoring every health questionnaire going back and forth. We use Hyatt, which is a top hotel in one of the most wanted hotel in Tijuana right now. One thing I want to mention, please keep working with our administration, working with our coordination once you sign up to complete your files. Because this, for example, Hyatt is so in high demand that if I don't book myself ahead of time, they won't even give me a room. So we have to make this reservation at least a month in advance. So if you add or change your reschedule, that means we lost that one spot or it's hard to get accommodation for you. Just a touch on the pre-op diet. Our pre-op diet is very simple, but it's very important in so many ways. Medically, it shrinks your liver, but it's a mindset, is a practice for you to show your commitment to this life-changing procedure. Remember, this is a life-changing procedure, and you need to commit to it. It's a tool you acquire, but you have to work with the tool. Yeah, it's magic, but you still need to eat well. You still need to get over hunger in your brain, the food chatter in the brain. So there are so many ways that pre-op diet helps you achieve successful post-op. And it's very simple It's just a matter of sticking to it, right? Your BMI, if it's low, you only need to do the 2-day clear liquid. And then it goes to 3 weeks based on your BMI. Again, try to stick to it. It's so beneficial in so many ways. Our surgeon liaison and the surgeons are the one tell you if you're taking a medication on a regular basis, which one to stop, which one to start. In general, Ozempic, if you're taking GLP-1, stop 3 weeks before surgery. No blood thinner in 1 week, no NSAID 1 week before surgery. And everything else will be communicated with you. If you're taking a medication on a regular basis, bring the bottles with you to Tijuana. Or if you go to Guadalajara. On the day that you arrive, we like you to arrive before noon. That gives us enough time to do all that we need to do pre-op to get you ready for the next day surgery. And your departure, we want you to be, if you're flying, be 2 p.m. or later. When you arrive, you have option to stay in Hospital Rosar or stay in Hyatt. You would pick that up. You make a choice when you do the consent form. On the day of the surgery, of course, if you're in the hospital, bang, you're there. If you're in the hotel, they tell you what time to show up. They take you to the hospital, and that's it. You stay in the hospital 2 nights. We do all of our leak tests. We check you out. You're good to go. You're ready to go back. If you have a long flight or you like to stay longer, it's a very easy thing to do. You tell your coordinator, we arrange for that. If you are staying in the San Diego side, again, that's another um, arrangement that you have to do, but it's possible. Our post-op diet, again, we send you all that information. Our nutritionists go over it with you. It's a 4-week transition from clear liquid to solid. And it's very important, again, to comply with that. Now, we were talking about education. This is the statistics we got from our patients. So shows after 2 years, you have average of over 200, 85% of our extra weight. You remember when we said about the extra weight? This is the percentage. Bypass up to 90, mini bypass the same, and duodenal switch SADI DS over 90%. And we do so good, again, the skill of the surgeon. Not every surgeon does the gastric sleeve the same. It's all called gastric sleeve. How it's done is based on the skill and experience of the surgeon. They've done so many of them. They know where to cut, how to cut it. That's why. And remember, when I was mentioning, our patients are so good that they come to us educated. That with our expertise together makes our success rate one of the highest, our complication one of the lowest, and the success rate one of the highest. Okay, so Dr. Montalvo, I don't need to say much about our surgeons. These are well-known surgeons around the world, but he's done more than these are just I think is all the statistics that he's done so many surgeries. He's a gastric sleeve um, expert. Um, I can't say enough about his specialty, about his bed manner. These guys are so genuinely caring doctors. I mean, they're not um, because I deal with them and they are so caring and they so careful about every and each patient. I'm going to let Dr. Montalvo take over and talk about all the different procedures that we offer. Thank you, Dr. Montalvo. I know you had the surgery and you just joined us, and I appreciate you. Thank you.
Hi, hello, good morning, everybody. Thanks, Ron, for that introduction. All right, let's start to talk about all our the options that we offer here at Mexico Bariatric Center. You can see we have a great view. You can see back here. All of our rooms have a very good and great view. So talking about the procedures, we offer all the procedure that exist. Um, just the most common is the gastric sleeve surgery. I think is one of the most uh, procedures in the worldwide. So also we can offer the mini gastric sleeve or the single incision sleeve, the all the bypass options like the R&Y or the mini bypass, the ideal procedures like the SATIs, SASIs, DS, all the laparoscopic gastric revisions and gastric reversal surgeries. Also, we have the endoscopic therapy like the gastric balloon and balloon removal, the endoscopic sleeve gastrectomy, endoscopic bypass revision. And also, we're starting with robotics. Okay, well, talking about the gastric sleeve surgery, we do the reinforced gastric sleeve, all right? What is this? So the gastric sleeve surgery removes like the 85% of the stomach using 1 to 5 tiny incisions. It's a minimal invasive laparoscopic procedure, and the size of the boogie or the tube that we use to calibrate the stomach of what we're going to remove is 34, 36 French. This procedure utilizes the restriction to limit the food intake, change the gut hormones that cause the hunger and satiety, and low gastric emptying. So what to expect with this kind of procedure? Decrease the levels of the ghrelin hormone. The ghrelin hormone is on the fundus of the stomach. It's on the part that we're going to remove. So also the increased levels of the GLP-1 and increase the levels of PYY and no changes in the GIP. What the pros here can be easily revised if needed in the future. Is high amount of excess of weight loss comparable to a bypass, resolutions of comorbidities like diabetes, hypertension, cholesterol, um, arthritis, and no changes to anatomy and less malabsorption. This means that only here we're going to remove a part of the stomach, but we're not going to make some changes on the intestinal transit. And the absorption is going to be the same, only that you're going to eat less portions. The recovery is short time. What are the cons over here? Can be worse if you suffer from a severe reflux or GERD, and it's not reversible. Here, the duration is 1 hour, 45 minutes. The hospital nights will be 2 nights, and the recovery, this will depend on what kind of activity you do. So, these go from 1 to 3 weeks. If you're in an office, only with 1 week is okay, but you make some lifting or driving or something more tough, it will take like 3 weeks. Okay. About the single incision gastric sleeve surgery is the same, but only here is that the operation is performed through one opening roughly 1.5 inches wide the umbilical or navel area. So in this kind, there is a hiding inside the belly button, so the abdomen looks scar-free and any drain tubes are removed. The expectations is going to be the same, decreased levels of ghrelin, increased levels of PYY and GLP-1, no changes in the gastrointestinal transit, and the same results as the classic BSG. The pros, is the same, can be easily revised, high excess of weight loss, resolution of comorbidities, no changes the anatomy, short recovery. And here, the only thing is that it's going to be more aesthetic because the incision is going to be high on the umbilical or navel area. The recovery is going to be the same, and the cons here is the same. If you suffer from a severe or acid reflux or GERD, it's going to be worse. It's not reversible. Here is just for patients less than 40 of BMI. The duration is like 1 hour, 1 hour and a half. You will be here 2 nights, and the recovery will be from 1 to 3 weeks. Okay, about the endoscopic gastric sleeve surgery. Here, the surgeon is going to put a tube inside, a video tube inside your mouth, and we're going through your stomach, and that way we're going to make a smaller stomach by folding the stomach to create a banana-shaped tube. This procedure utilizes restriction to limit how much the patient can eat at a time. Okay, so here, obviously, you're going to hold less food and decrease the food intake because we're going to put some inside stitches of the stomach. Obviously, lower amount of excess of weight loss and not well suited for patients with gastrointestinal bleeding, a large hiatus hernia, or previous abdominal surgery. The pros is reversible, reduced complication rate, no incisions, no removing incision or removing tissues, and short recovery. Here, the cons is a potential risk of partial openings of the stomach pouch and risk of ulcers. Here, the duration of this kind of procedure take like 30 minutes. You will be 9 at the hospital, and the recovery will be from 1 to 3 weeks. Okay. Talking about the bypass. This kind of bypass or the R&Y is the classic bypass. Here, the surgery forms a new stomach pouch while the remaining stomach stays in place. The small intestine are reroute to a bypass food digestion, which create malabsorption and reduce the calorie intake. So in this kind of bypass or the R&Y, the expectation is only slight decrease in ghrelin because sometimes the stomach is going to be on the remaining stomach is going to be there on their side, so there will be the ghrelin hormone working normally. So here are increased levels of GLP-1, PYY, and GIP is going to be decreased, especially in diabetic patients. So here the RY was or also is like the gold standard because was the first of the procedures, the first of procedures for weight loss. So the other procedures are more new. So that is why this is one of the gold standards. Improves the or basically relate comorbidity like diabetes, hypertension, sleep apnea. The cons here will be change of vomit and dumping syndrome and high risk of ulcers. And the other thing here is that the gastrointestinal transit is going to make some changes. All right. If you can see here on this picture, we need to make some connections, gastric pouch, and we need to make the connection 2 meters, 2.5 meters of the small bowel. So that way, that 2 meters is not going to function anymore, not going to absorb. That is why this procedure is a malabsorptive procedure. This will take us like 2 hours. You will be at the hospital 3 nights. And the recovery will be from 2 to 4 weeks. So what's the best surgery for a patient? That will depend of the medical history, will depend of your expectations. So that is why it's very important to put all your information on your medical questionnaire. the like I already said, the sleeve or the bypass, we can did it or we can make it on any BMI, all right? So, but here the most important is that if the patient have or had a previous bariatric procedure or abdominal procedure, if you have any or some bad reflux or severe reflux or GERD, if this is a revision surgery, if you want to make an altered of the anatomy and the average of excess weight loss at 1 year, it seems the studies shows that with the gastric sleeve will be like 65%, with the bypass around the 70%. So that is why it's very important to put all the information so we can make a recommendation. So what we think will be the best for you. Okay, the mini gastric bypass. Uh, Here is the mini gastric bypass is a bypass. So what's the difference between the RNY and the mini bypass? With the mini bypass, it's also called mini bypass or one anastomosis bypass or OAGB, because here is only one connection. That's the difference between the RNY and the mini bypass. With the mini bypass, divides the upper portion of the stomach to a tube like pouch with holds only 4 to 6 ounces of food. The intestine, like if you see on this picture, is looped to connect with the new stomach to decrease the amount of calories that you absorb. So proximally here, like in the RNY, we're going to exclude 2 meters of your small bowel, and we're going to make that connection with the pouch. So that 2 meters not going to absorb anymore. So what to expect with this kind of bypass? Reduce the feeling of hunger through the altered gut, early satiety and feeling full after small portions, reduce the calories and nutrients absorbed. So that is why it's very important to have your medical controls with your physician, so he can take some blood tests to prevent anemias, deficiencies, or other kinds of deficiencies of malabsorption. Resolve the diabetes type and hypertension, some comorbidities. The pros here is a single anastomosis or connection to the intestines. Safe, effective, and shorter procedure than a standard bypass or a PSG. And it's one of the most effective surgeries to revise failed gastric sleeve and lap band. The cons here is change of vomiting and dumping syndrome, higher risk of ulcers, and change of bile reflux. Here, the duration will be like 2 hours. You will be here at the 3 nights, and the recovery will take from 2 to 4 weeks. Okay, so again, what's the best surgery or bypass for the patient? It will depend uh, what kind of disease or problems or surgeries you had. Um, and obviously, both of them are great, okay, are great. But if you suffer from a severe reflux or GERD, the best option will be the RNY. But if you don't suffer from any kind of these problems, with the weight loss on both of them is going to be the same, because the connection, the most important thing is the connection for weight loss. Okay, that is the exclude the 2 meters and make the connection with the gastric pouch. Okay, talking about the duodenal switch surgery or SATIS and SASIS. Here, if you can see here in your right picture, we need to make more connections. All right. So the duodenal switch is also known as biliopancreatic diversion with duodenal switch. This is a powerful weight loss and metabolic surgery. So Here, the patient lose between 60 and 80% of the excess weight in the first year. Is high percentage of duodenal switch patients with type 2 diabetes are cured after the procedure, and malnutrition is a problem here with the DS, and the vitamin is must after surgery. So pros here is up of 80% of excess weight loss in the first year, stomach size reduced, high metabolic effect, and highest expect weight loss. But here the cons is extremely strict vitamins required for life, and higher risk of other bariatric is higher risk than other bariatric procedure. If you see here, we need to make like a gastric sleeve. We need to reroute your intestine. We need to make more connections. The duration here will be like 3 hours. So it's a little more of anesthesia. You're going to be 3 nights at the hospital, and the recovery will take from 3 to 6 weeks. This is one of the newest bariatric procedure and having more studies. Okay, well, the next we're going to talk about is the single anastomosis stomach ileal with sleeve, or is also they call that SASIs. Here is a new procedure that combines the gastric sleeve and the mini bypass benefits while reducing the nutrition risk. It preserves the natural digestion, lowering deficiency risk. Beyond restrictions, SASI harness hormonal shift and gut microbiome change for metabolic benefits. So here the expectations is to lose the 65-75% the excess of weight in the first year. High percentage of duodenal switch patients with type 2 diabetes are cured and less complex than the SADIs. Why? Because if you see here on this picture, also we need to perform a gastric sleeve and make only one connection with the small gut. So here is less cutting and stapling, less risk of leaks and acid reflux and nutrient deficiencies. So this can be revised to a gastric sleeve, a mini bypass, RNY, SADIs. The cons here is relatively new procedure and lifelong bariatric vitamins and mineral supplementation. Here, the duration of this kind of procedure will take from 3 hours. You will be at the hospital with 3 nights, and the recovery will take from 3 to 6 weeks. All right. So here are some comparisons of the duodenal switch and the SADIs. So both of them is more for patients with a very high BMI, over 50. Here, with the duodenal switch, the body absorbs fewer nutrients or calories, and dumping syndrome is one of it's poorly help relieve sleep apnea. An average of the excess weight loss in 2 years will be like the 80%. And the single loop or duodenal switch is one of the fewer anastomosis or mesenteric windows. So a new procedure with less data and less resolves irritable bowel syndromes. Average of excess weight loss will be also like the 80%. So it's very, very similar, both of them. The only difference is the connections. Okay, well, about the SASI and the SADIs, if you see here, in the SASIs is only one connection, all right? And then in the SADIs, the duodenals is connected to the idioms. So the connection is a little more in the front, or fewer of the stomach. In the SASI, if you see, it's at the end of the stomach, okay? But in the SADIs, it's at the duodenum, or the first part of the small bowel. So here, in the SASIs, the duodenum stay intact, so posing a low risk. And in the SADIs, we need to stapling the duodenum, all right? So this is a difference, a technical difference that, but it's very important, at least for us, okay? So here, if you can compare both of them, the average of excess weight loss in 2 years is also the same. It's around the 80%. Talking about the MACD, oh, okay. Well, the bariatric options first. Bariatric option comparison chart. Okay. Like we already said, here we have all the surgical procedure that we can offer. It will depend of what kind of medical history, or what do you expect of the future, or what do you have, if you have a previous abdominal surgeries or bariatric procedures, this will be the best for you. So you have 1, 2, 3, 4, 5, 6, 7, like eight options to offer. So the gastric sleeve will be the most, we can say, like the most simple procedure for weight loss. If you don't have a previous bariatric surgery, you're starting with this, it will be your first. The weight loss on almost all of them will be the same. All right. So if you already have a gastric sleeve and you want a revision, you have the other options, and that all of them are excellent, but it will depend of your medical history. Okay. So we have the gastric sleeve, the gastric bypass, the mini bypass, the duodenal switch, the SASIS, transient bipartition, and now the MACD procedure, that is a less invasive procedure using compression magnets instead of suture staples to perform the duodenoileostomy connection or the small bowel connection or a bypass. All right, but this is done with using magnets. About the revision surgery. The revision surgery is called for when the patient have a previous bariatric procedure or a previous abdominal surgery. When you come and you have another surgery, it will be a revision surgery. We're repairing, revision, or moving to another bariatric surgery, like the lap band to a gastric sleeve or a bypass or a SASI, the gastric sleeve to a bypass duodenal switch, or a bypass to a re-bypass or TOR-E, that this is an endoscopic procedure, or a duodenal switch, to another duodenal switch, or a bypass, or a MACD. So we also do revision for gastric balloon, ESG, BBG, and reversals. So the expectations here is to lose weight than was regained after a previous bariatric surgery, switch to another surgery that is more effective for the patient, and resolve issues from a previous surgery. This is when patients stuck on your weight or start with reflux. The pros here is continue losing more weight again, relieve complications from previous surgery like the GERD, and weight loss may be more effective. So the cons is the risk of complications, because obviously it's going to be another procedure. There will be some scarce tissue inside. It will take a little more time of recovery. And here the duration, it will be depend on what kind of a previous surgery, what we find inside of the abdominal cavity, what is the previous bariatric procedure. It will be from 1.5 to 4 hours. The hospital you will be from 2 to 3 nights, and the recovery will take from 1 to 4 weeks. All right, about the hiatal hernia. The hiatal hernia is a very common, finding when we are inside. Most of the patients don't know that they have a hiatal hernia. So when we find a hiatal hernia, we take we document with a picture so we can show it to you, and we need to repair it. It's very important this to prevent that your new stomach go to your diaphragm and the thorax, and that can be an emergency in the future. So hiatal hernia occurs when the part of the stomach pushes through the diaphragm, causing GERD is the most common symptom. And here we need to fix the hiatal hernia at the same time performing the bariatric procedure to prevent complications like the reflux, the vomit, or even strangulations of the stomach. The prevalence is in individuals with obese are 4.2 times more than normal because this is because of the abdominal pressure. So the high pressure on your abdominal cavity will push your stomach through your thorax. So this is 1 in 3 bariatric patients has hiatal hernia. The small hernias are repaired during the gastric sleeve, and large hernias or GERD history, here is preferred to make a gastric bypass. Repairs are done laparoscopically through small incisions, and unrepaired hernias can cause serious issues after the surgery. So if you can see here on your right side, the normal stomach is down of the diaphragm, and the hiatal hernia, the upper portion of the stomach go through that diaphragm and go through that thorax, and that is why the patient feels the reflux, the GERD, or the vomit. Okay, so one of the benefits of the bariatric procedure is to resolve the PCOS or the polycystic ovary syndrome. Uh, some patients have this kind of problem, and the bariatric procedure is shown to improve and reverse metabolic syndromes in women with PCOS, reduce the symptoms, and help restore normal ovulations, and numerous of weight loss surgery patients have been cured and overcome infertility. So, how fast can the patient return to work after a bariatric procedure? It will depend on what kind of job do you perform. So, if you're at the office and the procedure was asleep, from 1 to 2 weeks. But if it was a bypass or a duodenal switch, it will take from 2 to 4 weeks. The gastric balloon is you only need from one week, 2 weeks. It will depend on the symptoms. But if you're stand, walk, fast paced or lifting, it will take more time to the recovery. This is to prevent that. Obviously, you will see only 4 or 5 incisions, but inside your body is healing. So to prevent to have some damage or to prevent that you can fall and hit your abdominal cavity, and to give time to your body to recovery, we that's why we recommend from 1 to 4 and sometimes 8 weeks. That depends on what kind of job do you do. We also offer cosmetic and plastic surgery. Here at Hospital Hazard, facelift, plastic surgery, rhinoplastic. It means that of the plastic of their nose, tummy tuck, mommy makeovers, breast augmentations, breast lift, Brazilian butt lift or BBL, the liposuctions, arm tight lift, hysterectomy, and endometriosis, and also Botox, fillers, and skincare.
Thank you so much, Dr. Montalvo, for explaining, educating our patients about all different procedures we offer. Yeah, like you saw, we don't have one size fit all. And because we have the expertise to offer all that we offer, patients get exactly what they need instead of settling for what the surgeon or the center can do. Um, this is this is huge in the um, recovery in the success. And there's a difference between plastics and bariatrics because plastics, when you do a procedure, you can see um its appearance, it's obvious, but when you do something internal, you may not see what uh is not right or what can happen as a consequence. And this is what our center has been doing. We've been trying to give you the best. Actually, what I'm going to do is a couple of things. I already released the Zoom poll. Please go ahead and look for it and submit it to us. And I'm going to ask, like I mentioned, Kelly is our one of our past patient that actually is working with us. Um, we said talking about the benefits of work, getting surgery and getting surgery with us is one of them is you may end up working for us. And Kelly is one. And it's great to have her. Kelly, I'm going to let you um, take over if you're still with me. I think I lost her for a moment.
I'm here. Let me
Okay,
see.
great, great. Great to have you, Kelly. How are you?
Hi, Ron. Hi, Dr. Montalvo.
Hello.
Give me 1 second. Let me change my screen.
Okay, tell us.
Okay, sorry. So my name is Kelly, and I'm a bariatric patient as well. I had my surgery done 4.5 years ago in July 2021. At the time of the surgery, I was just like you, like Ron mentioned earlier, just a phone call away. At the time that before I made the phone call, I was just a patient like y'all. I didn't know night and day about surgery. I made that one phone call and I met my angel of a coordinator. She's still with us today. Her name's Amelia. She walked me through the patient process, made me feel very, very comfortable, and I knew exactly what to expect. I made that jump and paid the deposit that day and scheduled for my surgery. I want to say 2 months out. The time of the surgery, I weighed 220 pounds, 5'4", lost it within 8 months, went from a 220 to 125. So met my goal weight, went from a size 12, 14 to a size 4. And then 3 years later, I decided to get a mommy makeover. Since then, I've had a breast augmentation. I've had extended tummy tuck. I have lipo 360. Um, Skinny BBL and hip fillers. My For the first time in my life, I could honestly say I could wear a bathing suit or a bikini. I'm 52 and I could wear it confidence. I've never had that in the last 15 years. So I have my dream body now, and I just something that even when I talk about it, I just want to cry because I could never imagine that I would be sitting here today to be first for working for the company, helping other patients out to get to this journey. And it just has given my life back, and I couldn't ask for more. So don't hesitate, make that phone call, and make your dreams come true. 2026 is a time for transformation. So thank you, Ron. Thank you, Dr. Montalvo, and all the surgeons, and for everything that you guys have given me. Like I said, it's never too late. It just takes that one phone call. And then before you know it, that weight is coming off and you're active again, your health is better. I'm playing with my grandkids and couldn't ask for more. So that is my story.
Well, first of all, congratulations. Like we talked about, this is not a shortcut, you've come a long way and you look great, you feel great,
I do.
and great to have you as a part of a team.
When you start
Yeah.
this journey, you don't realize you don't do it for beauty reasons. You don't do it. I did it because I had a hormonal imbalance that was really bad. I had high blood pressure and I was a borderline diabetic. So I no longer have any of those issues at all.
Yeah, it's so great. Yes. Well, thank you so much, Kelly. I appreciate taking time to to come again. Always good, always great to have you. Thank
Thank you
you.
for having
All right. Okay, so like Dr. Montalvo mentioned, we do have actually plastic surgeons that are certified for plastics. And not only that, they are expert in post-bariatric patients. And post-bariatric patients need certain requirements for plastic that only certain surgeon can handle. And we offer these combo procedures that are very, very popular. We call them combo mummy makeover, which is multiple procedures in one operation. That saves you time and hassle of going through the surgery multiple times. Of course, remember the amount of procedures we could do in one operation is limited to the number of hours you are in OR. And believe me, we monitor that. We don't like more than 6 to 7 hours of being under, and we monitor all that. We have the best team of surgeons that they're doing what you guys need. We talked about hybrid procedures. So we do offer endometriosis and hysterectomy, and in some occasions we can actually combine these procedures together in one operation. For example, we've done sleeve and hysterectomy together. We can sometimes do maybe tummy tuck and endometriosis. So it's a lot of possibilities that the hospital is giving us that we didn't have before. Other options like knee replacement, hip replacement. Stem cell is a new kid on the block. Regenerative medicine is getting huge boost, especially in Mexico, because the way they do the stem cell, they have less restriction as far as what they can use for stem cell, and anything from anti-aging to spine, knee, all that is we can take care of stuff. So we jumped ahead with Kelly. Sorry, I didn't show these slides when you were talking because I got you ahead of the schedule. But here's some before after pictures. Yeah, Kelly, you look great. And again, we talk about the self-esteem, the years that you add to your life. This is something you really need to look at. Sometimes um, the money, the timing. Oh, I should take time off from work. Do it. This is a life-changing transformation. And if you ever have doubts, just talk to our staff, talk to Kelly, talk to Sarita, talk to any of our coordinators, and they tell you. Um, as far as the payments, we have so many options that you can pay us. Um, of course, taking cashier's check down there is one option, but make sure 15-day prior to your surgery, your payment is taken care of. Whether even if you're bringing a cashier check, just send a picture to your coordinator or the administration so they know how you're going to pay, so you would have least amount of headache or hold up when you're down there and you have a smooth transition. We want to focus on the surgery. We take credit card with sometimes FSA, HSA, and loans, of course. There are different ways you can get loan. We talked about MTI, medical tourism insurance. This is another benefit of going with us. We have negotiated down this price from $400 to $99 is only $99, one-time fee. There was a question on the Q&A that asked, is this monthly? No. It will cover you 45 days out from the day of the surgery. That means it will cover you even when you're back home in US, Canada, wherever your hometown is. and is a great thing to have for just peace of mind. We talked about our nutrition program. We do have actually Natalie is the one that is in our office here day to day, supporting you guys. We offer uh, Emerge, which is the best specialized bariatric vitamin in the market with the best ingredient and the most stringent to the standards of ASMBS, gives you exactly what you need. There are so many forms of it, so you can try to see what works best for you. And actually, they have they call them deluxe vitamin package that they give you um, 4 products. Wow, it's only $100. That's a great. Okay, so I think we are at the point that we are going to again. I did open the Zoom poll, and I'm going to start answering questions so we can get hopefully we can get finish in there 2 hours and do the raffle. Um, there was a question here about um let me do this. So they're talking about low iron and being anemic. That's a great question. We we recommend, highly recommend. For plastics is a mandatory, for bariatrics is optional. Please do a blood count before you come, a month ahead or some previous to coming to us. That shows if you have low iron, hemoglobin levels, and you can start taking care of it before you come to us, especially for people who are coming for revision. I highly recommend that because when you do a first surgery, your initial surgery may cause you being anemic. And please, let's take care of it before you get down there. And we don't have to do blood transfusion or any of that. So that's one of the good ones. Um, so w there been a bunch of questions about being um, the blood clot. And probably I let Dr. Montalvo talk about that. So let's see if they have had an episode of blood clot previously in few years ago, or they're worried about long flight times going home. What is the protocol for making sure they don't get blood clot?
Okay. Well, first of all, we need to know what kind of medication you're using. That way, our internist can make some recommendations. Most of the patients uh, are under control with the cardiologist, and that way we can make the switch to the other blood thinner, and that way when you come here, you complete your protocol of switch, and we can have no problem with your procedure. Most of the patients, we need to make that switch like 1 week before the surgery day of surgery. So and sometimes it's the make the switch to Lovenox, and they need to suspend to stop it 3 days, 4 days before the day of the surgery to prevent bleedings. But when we finish, immediately when we finish the procedure, we put the first shot of blood thinner, and it will depend how are you using or the recommendations of our internist, how long you're going to take the blood thinner uh, how many days you're going to take it again and make the again the switch to the blood thinner that you're using normally. But it's very important to have all this information.
Um, so maybe you want to mention about, I know you have one of the best anesthesiologists on your team. Again, that's just something we need to talk about. When we talk about this surgical team is great, it's not just the surgeon, it's the whole team. Is there assistant surgeon? Is there instrumentation? Is the anesthesiologist? So if you want to say something about your anesthesiologist, how experienced it is, what type of, um, experience.
Okay,
Yeah.
Dr. Nelson uh, is one of the top of the anesthesiologists. Why? Because he had training and he's a cardio anesthesiologist. And now I said to him, he's a cardio bariatric anesthesiologist. So he had like three specialties, and he's the one who's going to taking care of you. So obviously he have or he's in very in a lot of communication with our internists. They are great. They have a great communication. So when we have a special case, obviously we discuss all the options. Our internist, the anesthesiologist, and me. So when we have a special patient with something medical medical problem or issue, we discuss and take the very best option for you. So the anesthesiologist is the one who's going to take care of your breathing and your heart. So Dr. Nelson have a lot of experience. I think he's in this like I can mention like 30 years on cardio anesthesia, and like more than 10 years in bariatrics. So I think you can be in better hands.
Yeah, that's why I asked you because it was a question about it, and I know you have one of the best cardio anesthesiologists out there. And again, there's a difference between some anesthesiologists, young one just came from school, and then there is one that has so many years and is expert in the cardio. So these are little details that makes us one of the best provider because of all these little things that we do differently and we do best. Um, so there was another question I was going to ask you. Again, if you're doing a bariatric surgery and you want to do a plastic with that combo, it doesn't make sense because you're going to lose weight, you're going to need more work. So why do things when it's not time? Actually, we do require you to be at least 1.5 years out from bariatric surgery to go through plastics because you want to get to a point that you have stabilized your weight loss and you don't lose more weight. You're at a point that you feel good. You're comfortable with your weight. Is your goal weight or is your ideal weight? Like Kelly did, you know? Um, so just wait until you lose all the weight, come back and you do what you have to do if you need some more work done as far as plastics, skin removal. So the prices that we offer is really self-pay. There are some incidents that we've seen patients asking for more invoices and documentation to go back to their insurance to collect the surgery part of the package. And it is possible. You may want to look into it, but that's something you have to do after the procedure itself. Okay, so I all of a sudden I got like 57 open question. Again, love to go over this. We wanted to keep it under 2 hours. I love to be with you guys and keep going, but not, we all have things to do, and I don't want to keep you more. So what I'm going to do is I'm going to do the raffle right now. And any questions that was not answered, please go ahead and reach back to us. Again, we have that's something I was just talking about the other day. You know, the level of service, like right now in US, when you want to reach out to your provider, whether it's your cell phone, anything, internet provider, whatever, they putting you through AI and there is no representative to answer. Our coordinators are around the clock working with patients. You cannot get this kind of support. And we all in US, um, these are people that they love to help you. They're willing to help you. So I would say take advantage of this. There's no way in these days that you can get live people on the phone that can talk to you and support you. So anyway, so that's why I'm saying if you didn't get, I know there are so many good questions like that people need to know. Again, there are other ways to ask these questions too. I know at least one live with the surgeons on Wednesday, 10 a.m. Pacific time on Facebook. 10 a.m. Wednesdays, you can get on with the surgeons, rotate. You can ask questions. You can ask questions from us on the webinars. You can ask questions about us on Zoom. You can ask us questions on the phone, text, email. Okay, so there you go. This is the, oops, one of them flew away. So this is the name of the participant. I'm going to pull one randomly. And let's see. So Jennifer Falcon. Jennifer Falcon is our lucky winner. You guys are all lucky because you are taking control of your life. And Jennifer, I'm letting you talk. I'm asking you to unmute yourself so you can share your story with us. Hi, Jennifer.
Hi,
Hello.
welcome.
Where are you located? Which city do you live?
I'm in San Antonio, Texas.
Wow. Okay. Okay. So tell us about your journey. What are we looking at?
Um, I've actually been, researching you guys a long time, and I've always been like hesitant, but I think I'm finally ready to do it this time. And probably within like a month or two, I'm gonna take my big step and go ahead and do it.
Oh, that's great. Well, congratulations.
Thank you.
Love to see you down there. We will have one of the coordinators contact you. If you contact them first, is
Yeah,
great.
I've already been talking, I think, with Tatiana.
Okay, okay, Tatiana. Yeah,
Yeah.
great. Yeah, so well, anyway, I appreciate every one of you guys joining us today. Dr. Montalvo, we always appreciate you taking time. And Kelly, same. Thank you for taking time. And we will see you next time. And please reach out to us if you have any questions. All right. Thank you. Have a great
Yeah.
day.
Thank
Bye-bye.
you.
Bye-bye.